The ocean has always been a symbol of power.
Vast.
Unpredictable. Unforgiving. But what if the most advanced hospitals on Earth didn't stand on land, but sailed through storms? What if cutting-edge surgery, AI diagnostics, robotic operating theaters, and emergency trauma units could deploy anywhere on the planet, independent of borders, infrastructure, or disaster zones? Tonight, we explore a bold and controversial vision. Cutting-edge hospital ships engineered by Maxwell Chikumbutso, floating medical cities designed not just to treat illness, but to redefine global healthcare access. Imagine a vessel stretching hundreds of meters across the horizon. Its exterior is sleek, aerodynamic, built with reinforced marine composites designed to withstand violent seas. But inside, it feels nothing like a ship. It feels like the future. The entry deck opens into a triage command center powered by artificial intelligence. Patients are scanned instantly using non-invasive biometric systems. Vital signs, blood chemistry, and internal imaging are processed in seconds. AI prioritizes critical cases before a human doctor even speaks. This is not science fiction. It is mobile precision medicine. Each hospital ship is divided into intelligence zones. Surgical theaters equipped with robotic arms capable of micro-precision procedures. Isolation wards with advanced negative pressure containment systems. Neonatal care units designed for high-risk births in crisis regions. Oncology labs for rapid cancer screening. And everything is modular. Entire departments can be reconfigured depending on the mission, pandemic response, natural disaster relief, rural outreach, or conflict zone stabilization. Unlike traditional hospital ships that rely heavily on port docking, these next-generation vessels are engineered for semi-autonomous offshore operation. High-speed deployment crafts ferry patients from coastal areas. Drone fleets deliver emergency medical supplies inland. Energy is where the design becomes even more radical. Instead of relying solely on diesel propulsion, the ship integrates hybrid marine energy systems, combining advanced battery arrays, waste heat recovery, and experimental kinetic ocean converters. The result: extended deployment times without constant refueling. Sustainability meets survival. Inside the main operating theater, robotic surgical platforms allow specialists from across the globe to assist remotely. Through secure satellite links, a cardiac surgeon in Europe could guide a life-saving procedure taking place in the middle of the Indian Ocean. Distance collapses. Healthcare becomes borderless. The ship's onboard pharmaceutical lab manufactures essential medications in real time using compact synthesis systems. No waiting for supply chains. No dependency on overwhelmed logistics networks. In disaster scenarios, speed is everything. Within 48 hours, this floating hospital can transform a devastated coastline into a functioning medical hub. Water purification systems produce thousands of liters of sterile water daily. Desalination units ensure continuous supply. AI-managed inventory tracks every syringe, every vial, every surgical instrument. Nothing is wasted. Nothing is delayed. But beyond the technology lies the deeper ambition. Accessibility. Many remote regions lack permanent hospitals. Infrastructure takes years to build. Political instability slows development. Yet a mobile hospital fleet could rotate across underserved coastlines, delivering specialized care on scheduled cycles. 1 month in West Africa, the next in Southeast Asia, then South America. A global circuit of healing. Critics argue that such ships would require immense funding, that maritime medical infrastructure is complex, that regulatory frameworks across nations create barriers. But innovation has always faced resistance. When aircraft carriers were first imagined, they were dismissed as impractical. When telemedicine began, skeptics doubted remote diagnostics. Today, both are standard practice. The same question now stands before floating super hospitals. What if healthcare didn't wait for patients to reach it? What if it traveled to them? Inside the lower decks, advanced research labs conduct live epidemiological monitoring. Environmental sensors track viral mutations in coastal populations. Real-time data feeds global health networks, creating early warning systems for emerging outbreaks. The ship doesn't just treat disease. It predicts it. Artificial intelligence models analyze patterns, migration flows, climate events, sanitation metrics, identifying high-risk zones before crises escalate. Prevention becomes proactive, not reactive. And then there's the humanitarian impact. In the aftermath of hurricanes, tsunamis, or war, local hospitals are often the first structures to collapse under pressure. A self-sustaining medical vessel anchored offshore provides immediate reinforcement. It becomes a symbol of stability, a beacon of light against smoke-filled skies. Families line temporary docks as rapid transport boats bring patients aboard. Inside, calm replaces chaos. Precision replaces panic. Doctors and engineers move in synchronized coordination. Every corridor is optimized for speed. Every system designed for redundancy. Even in the worst storm, the hospital ship remains operational. Gyroscopic stabilizers counter violent waves. Smart hull systems adjust buoyancy in real time. Critical surgical platforms remain perfectly level, even as the sea roars beneath. Because when lives are on the line, instability is not an option. And as the ship sails toward its next mission, its presence sends a message to the world. Healthcare is not confined to geography. It is mobile, adaptive, borderless. Yet this is only the beginning. Engineers are already conceptualizing smaller support vessels, rapid response medical cruisers that operate alongside the primary hospital ship. AI-managed supply submarines capable of underwater logistics in high-risk areas. Autonomous sanitation drones sterilizing disaster zones before patients are even evacuated. A floating ecosystem of medicine. A distributed network of maritime healthcare infrastructure. As global populations rise and climate-related disasters intensify, the demand for rapid medical deployment will only grow. The question is no longer whether such ships are possible. The question is whether the world is ready for them. And somewhere beyond the horizon, beneath a sky painted with fading sunlight, a prototype vessel continues its silent trials at sea. Testing systems. Refining algorithms. It may arrive by ocean. And when it does, the world will witness something it has never seen before. At first, there is only a silhouette on the horizon. Massive, deliberate, moving with quiet authority through restless waters. Satellite feeds track its trajectory. Global news networks scramble for confirmation. Governments coordinate docking corridors. Humanitarian agencies activate emergency protocols. But on board, there is no chaos. Only precision. The command bridge resembles more of a space agency control center than a maritime cockpit. Transparent OLED displays project weather models, coastal damage analytics, patient intake projections, and predictive casualty maps powered by real-time AI simulations. Every incoming data stream, from drones, satellites, and on-ground responders, feeds into a central neural network that calculates optimal medical response strategies within seconds. The ship doesn't react. It anticipates. Below deck, entire surgical teams run high-speed simulations before patients even arrive. AI-assisted holographic modeling reconstructs injuries based on drone imagery from affected areas. Surgeons rehearse complex trauma procedures in immersive mixed reality environments, reducing error margins before the first incision is made. Preparation becomes a weapon against uncertainty. Meanwhile, autonomous landing crafts begin their rotations. Some retrieve critically injured civilians. Others transport portable diagnostic pods inland. Each pod unfolds into a self-contained microclinic, equipped with rapid blood testing, ultrasound scanning, and emergency stabilization equipment, all wirelessly linked back to the mothership. Distance becomes irrelevant. Even in regions where roads are destroyed and communication lines severed, care flows like a coordinated tide. Inside the main atrium of the hospital ship, modular walls shift silently. What was a general ward hours ago transforms into an infectious disease containment unit. Airflow systems reconfigure. Robotic sanitation arms sweep ceilings and corners with ultraviolet sterilization beams. Smart surfaces embedded with antimicrobial nanocoatings actively neutralize pathogens. Nothing is static. Everything adapts. The onboard data core continues processing global health metrics. Patterns emerge. A spike in respiratory complications. Unusual biomarkers. Environmental toxin exposure from floodwaters. The system flags potential secondary crises before they fully materialize. And here lies the true evolution of such vessels. They are not merely reactive emergency platforms. They are floating research institutions. Medical scientists on board sequence viral genomes in real time. Bioinformatics algorithms compare mutations against global databases. Treatment protocols update dynamically across departments. International health organizations receive encrypted reports within minutes. Knowledge travels faster than the disease. In quieter corridors of the ship, long-term care patients begin recovery programs. Rehabilitation robotics assist those with spinal injuries. AI-guided physiotherapy platforms adapt exercises based on muscle response data. Psychological support teams conduct trauma counseling sessions inside immersive therapeutic environments designed to stabilize stress responses. Because survival is only the first step. Healing is the mission. And as weeks pass, the once devastated coastline begins to stabilize. Temporary clinics, supported by the ship, transition into permanent infrastructure projects. Engineers collaborate with local governments to design land-based medical centers informed by data gathered during deployment. The ship does not replace infrastructure. It seeds it. Before departure, thousands of patients have been treated. Hundreds of local medical professionals have received advanced training. Autonomous supply networks remain active, ensuring continuity of care. The vessel slowly retracts its stabilization systems. Anchor lifts. Propulsion hums to life. But this departure is not an ending. It is a shift to the next horizon. Out at sea, energy systems recharge under hybrid marine cycles. Ocean kinetic turbines spin beneath the hull. Battery matrices balance load distribution. Maintenance drones inspect structural integrity, scanning every square meter for stress signatures. The ship evolves after every mission. Software updates refine predictive modeling. Surgical robotics calibrate based on real-world performance metrics. Resource algorithms improve efficiency curves. Each deployment makes the next one stronger. And perhaps the most profound transformation is philosophical. For centuries, healthcare has been tied to fixed locations, buildings, cities, nations. Access determined by geography and economics. But floating hospital systems challenge that model entirely. What if medical capacity could shift globally in response to climate migration patterns? What if island nations vulnerable to rising sea levels had permanent rotating hospital coverage? What if pandemics were met not with overwhelmed local systems, but with mobile reinforcement fleets already en route? The implications stretch far beyond emergency response. Maritime healthcare corridors could redefine global equity. And as prototypes transition into operational fleets, other innovators begin exploring complementary technologies. Advanced logistics platforms. AI-driven disaster prediction satellites. Autonomous construction vessels capable of rebuilding coastal infrastructure in parallel. An ecosystem begins to form. Not just ships, but a network. A living, adaptive global medical grid. Some will call it ambitious. Some will call it unrealistic. Some will question funding, governance, and geopolitical complexity. Yet progress has always demanded bold imagination. The first steel ships were doubted. The first airplanes were dismissed. The first digital networks were underestimated. And now, somewhere in international waters, under a sky lit by distant stars, a hospital ship glides forward, quiet, self-sustaining, waiting for the next call. Its decks hum with restrained power. Its corridors stand ready. Its systems remain alert. Because the ocean never sleeps. And somewhere deep within its core, beyond the visible decks and surgical chambers, the ship's central intelligence continues learning. Every heartbeat monitored. Every procedure performed. Every anomaly detected. Patterns form inside vast neural networks. Correlations between climate volatility and infectious outbreaks, between migration flows and chronic disease spikes, between infrastructure collapse and trauma severity ratios. The system refines global risk maps in silence. The vessel is no longer just a responder. It is becoming a strategist. Weeks after its last deployment, encrypted signals arrive from another region facing instability. Not a natural disaster this time, but a slow-building humanitarian strain. Food shortages, rising water contamination, clinics overwhelmed by preventable illnesses. Before official requests even finalize, predictive models have already simulated capacity requirements. Surgical staffing rotations are adjusted. Pharmaceutical synthesis units begin producing targeted medications. Drone inventories recalibrate for terrain-specific logistics. Preparation begins long before headlines do. On the training deck, medical personnel from multiple nations participate in live response drills. Surgeons operate alongside AI-guided robotics in synchronized precision. Emergency coordinators rehearse multi-language communication protocols. Engineers test fail-safe redundancies under simulated cyber stress conditions. Because, in a connected world, resilience must include digital defense. The ship's cybersecurity architecture evolves continuously, shielding patient data and operational systems from interference. Quantum-encrypted channels guard international collaborations. Redundant satellite arrays ensure communication remains uninterrupted, even during geomagnetic storms or infrastructure blackouts. Resilience layered upon resilience. Below the waterline, autonomous maintenance drones glide along the hull, inspecting microscopic stress fractures with laser precision. Smart polymers in the ship's exterior respond dynamically to temperature shifts and pressure fluctuations. Structural algorithms optimize balance in real time, reducing fuel consumption and mechanical strain. Efficiency becomes invisible, but essential. Inside recovery wards, children once caught in disaster zones laugh again. Elderly patients receive long-delayed surgeries. Mothers hold newborns delivered safely despite chaos beyond the horizon. Moments like these never trend on financial markets, yet they redefine value. As global observers begin analyzing deployment metrics, something unexpected emerges. Mortality rates in serviced regions decline faster than historical averages. Disease containment accelerates. Local healthcare systems show measurable long-term strengthening after each visit. The model proves scalable, and whispers of expansion circulate among policymakers and private innovators alike. Regional fleets stationed strategically across oceans. Cooperative funding alliances. Public-private partnerships merging maritime engineering with humanitarian medicine. But growth introduces complexity. Who governs such fleets? How are missions prioritized? How is neutrality preserved in politically sensitive waters? These questions linger, not as obstacles, but as necessary conversations shaping the next phase of evolution. Back on deck, as the ship prepares for another journey, sunrise spreads across open water. Golden light reflects off reinforced glass panels lining the upper corridors. Crew members move with calm focus, checking diagnostics, reviewing projections, finalizing logistical pathways. There is no grand announcement, no dramatic soundtrack, only motion, steady, intentional, forward. And as engines engage once more, the vessel charts a path toward another coastline, another community in need of reinforcement before collapse turns into catastrophe. This is no longer about proving possibility. It is about demonstrating inevitability. Because in a century defined by climate volatility, geopolitical tension, and rapid technological transformation, adaptability will determine survival. Fixed systems fracture under pressure. Mobile systems endure. And out on the open ocean, beyond borders and beyond politics, a new paradigm of healthcare continues to take shape, quiet, intelligent, and relentlessly prepared. The horizon stretches endlessly ahead. New data streams flow in. New simulations begin. New missions form in digital blueprints before becoming physical realities. The ship does not wait for crisis to define it. It defines its response before crisis unfolds. And somewhere, in a coastal village not yet aware of the future approaching from beyond the sea, life continues as usual. For now. But when the tide shifts, whether through storm, outbreak, or unforeseen emergency, a silhouette will once again appear at the edge of the water. not as an intruder, not as a conqueror, but as a guardian carried by waves. And even as it moves toward that unseen destination, engineers within its core are already drafting the next generation: faster vessels, smarter systems, deeper integration with global health networks. Because evolution never pauses. It builds upon momentum. It refines. Further still, beyond what current maps can measure. Inside the Strategic Command Chamber, projections begin extending decades ahead. Climate displacement corridors are layered over maritime routes. Artificial intelligence models simulate where the next megastorms are statistically most likely to strike. Ocean temperature anomalies are cross-referenced with epidemiological forecasts. The ship is no longer planning for the next mission. It is planning for the next era. Engineers initiate trials of deployable floating platforms, expandable extensions that can detach from the primary vessel and anchor closer to shallow coastlines. These platforms unfold like mechanical pedals, forming temporary surgical piers, triage hubs, and supply distribution centers. A single ship becomes a constellation. And with each iteration, autonomy deepens. Robotic surgical systems begin performing lower-risk procedures independently under human supervision. Pharmaceutical labs onboard experiment with localized 3D printed medications, calibrated precisely to genetic and environmental factors specific to each deployment zone. Personalized medicine at maritime scale. In the education wing, augmented reality classrooms train regional healthcare workers remotely. Local students connect through satellite links, witnessing live demonstrations of advanced procedures. Knowledge transfers in real time, collapsing decades of disparity into moments of access. The vessel does not simply treat. It teaches. It replicates capability. It multiplies impact. Meanwhile, propulsion systems undergo silent upgrades. Experimental hybrid reactors draw from tidal flow, solar arrays, and advanced battery matrices. Energy surplus is stored not only for navigation but for emergency grid restoration upon docking, allowing entire coastal districts to regain electricity within hours. Healthcare merges with infrastructure. Support merges with stability. On the analytics deck, economists and public health experts begin noticing something profound. Regions visited by the ship show increased investor confidence months later. Supply chains stabilize. Local innovation hubs emerge around the newly strengthened medical centers. A ripple effect. Healing becomes economic momentum. And yet, the mission remains fragile. International waters are complex. Geopolitical tensions simmer. Not every port welcomes external intervention. Diplomatic teams on board work continuously, navigating permissions, agreements, and assurances of neutrality. Trust must be earned with every arrival. Back inside the intensive care wing, the quiet hum of machines forms a rhythm. Biometric monitors pulse steadily. Autonomous infusion systems adjust microdosages with machine precision. Overhead lighting shifts subtly to match circadian cycles, optimizing patient recovery. Even the smallest variables are engineered for advantage. In the research laboratory, new pathogens are sequenced within hours of detection. AI cross-references environmental data, travel patterns, and historical mutations. Early containment protocols are drafted before outbreaks breach critical thresholds. Prevention overtakes reaction. And somewhere in the lower decks, prototype blueprints glow across holographic drafting tables, next-generation vessels with modular hulls capable of separating into coordinated fleets. Ships that can traverse polar waters. Ships designed for equatorial cyclone belts. Ships equipped for volcanic ash contamination zones. Specialization begins to emerge. The idea evolves from one flagship marvel into an adaptable ecosystem of maritime guardians. Outside, the sea darkens under gathering clouds. Storm systems churn miles away, yet the vessel remains steady. Stabilization gyros compensate for shifting currents. Structural AI recalibrates balance in real time. Strength without aggression. Power without spectacle. As lightning fractures the sky in the distance, a new alert pulses softly across the command interface. Another coastline. Another anomaly. Rising infection rates following unseasonal flooding. No panic spreads through the corridors. Only motion. Data uploads. Routes adjust. Teams mobilize. And as engines rotate toward this new vector, the ship cuts through gathering waves, not racing, not retreating, but advancing with calculated calm. Because the future of global healthcare may not be built solely on land. It may travel. It may adapt. It may rise and fall with the tides. And as long as the ocean remains vast and humanity remains vulnerable to forces beyond its control, there will be need for systems that move faster than disaster, think faster than uncertainty, and act before hesitation costs lives. Somewhere ahead, beyond the storm line, another horizon waits. Unseen, unprepared, but not unreachable. But even the most advanced intelligence understands one fundamental truth. Technology alone is never the hero. People are. Inside the command deck, the screens dim as the final approach begins. The coastline ahead is fragile, battered by flooding, hospitals overwhelmed, power grids unstable. Yet as the ship moves closer, something shifts in the atmosphere. Hope becomes visible. Landing crafts deploy in synchronized silence. Medical teams descend with precision, not as saviors, but as partners. Local doctors step forward. Volunteers gather. Coordination replaces confusion. Within hours, triage lines stabilize. Within days, mortality rates begin to drop. Within weeks, infrastructure blueprints are drafted for permanent facilities built stronger than before. And in the middle of it all, something subtle but powerful takes place. Knowledge transfers. Local engineers learn how to deploy modular systems. Nurses train on advanced robotics. Public health coordinators gain access to predictive tools that will remain long after the ship departs. The mission was never to create dependence. It was to create resilience. As the final patient is discharged and the temporary coastal platform retracts, the ship prepares to leave once more. Crew members stand along the upper deck, not in ceremony, but in reflection. They know this is only one chapter. The anchor lifts. Engines hum. The coastline grows smaller behind them, but stronger than it was before. Out at sea, the vessel re-enters open waters, data streaming into its core, lessons archived, systems refined. The next generation of maritime medical platforms is already in development. Faster response times, greater autonomy, wider global coverage. Because the vision was never about a single ship. It was about a shift in how humanity protects itself. A future where medical access is not determined by geography. A future where disaster does not automatically mean collapse. A future where mobility becomes security. As night falls, the ocean reflects a field of stars. The ship glides forward, steady and prepared, carrying within it not just technology, but intention. Somewhere, another call for help will come. Another horizon will demand courage. Another storm will test the limits of preparedness. And when it does, a silhouette will appear at the edge of the water once again, quiet, powerful, and ready. Not as a symbol of dominance, but as proof that innovation, when guided by purpose, can travel anywhere. The ocean stretches endlessly ahead. And so does the future. 20 image prompts according to the script.